People most at risk of getting unwell with the flu are the very young, less than 3 months, the very old, and especially those in aged care facilities, Aboriginal and Torres Strait Islanders, and pregnant women. Pregnant women we like to vaccinate because that protects their unborn baby. So really everyone should get vaccinated, not just because you might get sick with the flu, but because you stop spreading it to other people. And everyone has probably had enough time off work these days too, that you don't want to get the flu and be at home again for another week. So whether you're well and going to work, whether you've got young children, whether you've got parents in aged care facilities, everyone really should get vaccinated. The flu can easily be managed at home. Most people are better within about 5 days. They need to make sure they have paracetamol or ibuprofen, drink plenty of fluids, rest and eat good food. The symptoms that we get worried about are fever that lasts more than 2 to 3 days, shortness of breath when you're walking, dizziness when you stand up, not keeping any fluids down and urine output dropping off, or if you become confused. So if the symptoms have been lasting for 3 or 4 days, especially very high fevers, it's very important to check in with your GP. There's 2 reasons for this. One is that it could be an alternate diagnosis. It may not actually be flu. It could be, say, a urine infection or some other type of infection. The other reason is that occasionally the flu does turn into pneumonia, and at that point you may need antibiotics. If you're unwell, wear a mask when you go out to busy crowded areas such as shopping centres, don't visit aged care facilities or other high-risk areas, and if your children are unwell, keep them at home as well and don't send them to childcare or school.